Exactly 6 years ago, on December 1st, 2019, a single moment in the city of Wuhan, China, quietly marked the beginning of one of the greatest global crises in modern history. On that day, a man developed unusual symptoms, an unexplained fever, persistent fatigue, and respiratory issues. At the time, it seemed like a simple and isolated illness. No one knew that this solitary case would soon be identified as the very first confirmed instance of what the world would come to know as COVID-19. This date has since become a silent timestamp, a historic marker that changed the trajectory of billions of lives across every continent. In those early days, the world was unaware. Life continued normally. People traveled, worked, celebrated, and planned for the coming year. The city of Wuhan, with its busy markets, crowded streets, and vibrant lifestyle, gave no hint of the storm that was gathering. Doctors and scientists had no reason to suspect that a new virus was taking shape, one that would challenge global health systems, test governments, and redefine human behavior for years to come. As December 2019 progressed, more patients began appearing in local hospitals with similar mysterious symptoms. Doctors noticed patterns, but did not yet understand the threat. Some believed it was pneumonia. Others suspected exposure to animals in the famous Wuhan seafood market. But none imagined that the illness was a new coronavirus, one capable of spreading rapidly and silently from person to person. By the end of December, whispers of a strange outbreak started circulating among medical workers in Wuhan. Still, the world remained largely unaware. Travel continued between countries. Celebrations for the new year were being prepared, and normal life carried on with full energy. The virus, however, was already moving. It was crossing homes, neighborhoods, and soon, borders. When January 2020 arrived, the situation began escalating. China reported clusters of cases, and scientists identified the virus as a novel coronavirus later named SARS-CoV-2, yet even then, most nations did not anticipate the scale of the disaster that was coming. Flights were still operating. Borders were still open. People were still gathering in large crowds. The virus, spreading silently, was only gaining strength. By February, COVID-19 began appearing in countries across Europe, Asia, and the Americas. What started as a single case in one city became a global threat. Hospitals in many nations saw rising admissions. Doctors battled a disease they did not yet fully understand. Governments scrambled to respond. Panic began to spread along with the virus. Streets that once echoed with life soon became empty. Schools, malls, airports, offices, and entire regions shut down. For the first time in modern history, the world nearly came to a standstill. By March 2020, the World Health Organization declared COVID-19 a global pandemic. Humanity entered a new chapter. The routines and freedoms taken for granted suddenly changed. Masks became mandatory. Hand sanitizers became essential. Social distancing became a rule in every country. Simple things, meeting friends, shaking hands, hugging family, became risks. Healthcare workers stood on the front lines, fighting day and night, often without rest. Battling the rising wave of infections, millions fell ill, and over the next few years, countless families faced loss, grief, and fear. Economies collapsed, jobs were lost, and education shifted entirely online. The world experienced shortages of basic supplies. Hospitals were overwhelmed. Emergency rooms filled beyond capacity. Nations imposed strict lockdowns. International travel nearly stopped. It was a period unlike anything the modern world had ever seen. Yet, in the middle of this crisis, humanity also witnessed incredible unity, resilience, and innovation. Scientists across the world rushed to study the virus, share data, and develop vaccines at unprecedented speed. Frontline workers risked their lives every day to save others. Communities organized support networks. Neighbors helped neighbors. People adapted to working from home, studying online, and staying connected through digital communication. By late 2020 and early 2021, vaccines began to emerge, one of the fastest and most remarkable scientific achievements in history. Slowly, the world started to fight back. The death rates decreased, recoveries increased, and countries gradually began reopening. Although the virus continued to evolve and new variants appeared, humanity had tools and knowledge that did not exist in the early days. Today, December 1st, 2025, marks exactly 6 years since that first known case appeared in Wuhan. 6 years since the world unknowingly stepped into a new era. This day is not just a reminder of a disease. It is a reminder of how interconnected humanity truly is. One illness in one person in one city became a crisis that touched every corner of the planet. It taught us about the fragility of life, the importance of preparedness, and the strength that emerges when people stand together. This day also symbolizes how a single moment in time can reshape global history. It reminds us of the sacrifices made by doctors, nurses, essential workers, and countless individuals who risked their lives to protect others. It reminds us of the millions who endured loss. And it reminds us how far we have come from fear and uncertainty to understanding and recovery. Today, as the world continues to move forward, December 1st remains a powerful marker. Not to cause fear, but to teach, to remember, and to honor the resilience humanity showed in the face of a global threat. The story of COVID-19 is still being written, but the lessons it taught us about science, unity, and the fragility of human life will remain for generations. The events of that day in 2019 started quietly, unnoticed, but they reshaped the world. And now, 6 years later, the memory of the first case stands as a reminder of how much we have endured, how much we have learned, and how much we must continue to prepare for the future. The world may never forget the challenges brought by the pandemic, but it can also remember the strength, bravery, and solidarity that emerged in response. The legacy of that single moment in Wuhan is not just about the beginning of a virus, it is about the beginning of a global chapter that tested humanity and proved once again that even in the darkest times, people can rise, rebuild, and move forward with hope.